Hello and welcome to episode number 2 of Pelvic Pain Unpacked. I'm your host, Tamar Hill, and my co-host today is
Dr. Hill.
Dr. Hill, my sister and my medical advisor. That's her. So Dr. Hill, I will call her Charity because she's my sister and she's younger, so I can call her that. Today's episode is going to focus on CBD to relieve pelvic discomfort. And that is a really wide umbrella, but really what MediRoots' goal is to help people with pelvic pain and pelvic discomfort, get some natural, non-narcotic solutions to pelvic pain relief. And a lot of these are literally, I get phone calls and emails and we get reviews about how this is changing people's lives. And you know, it's not specific to women, but women definitely are benefited, but it doesn't matter who you are, man, woman, trans, does not matter. If you're a human with a pelvis, we can help you. Is that right?
That's true.
All right.
Any pelvis that hurts,
We have got a potential solution to your pelvic problems. We have so many P's, it hurts, even if it hurts to pee-pee. Okay, ridiculous. We've got a potential solution for that. So, Dr. Hill.
Yes, ma'am.
I just wanted to go over some of the pelvic pain conditions that you saw in your practice or in general, and I'm going to give you a little bit of a quiz.
Okay,
so,
sounds good.
And I need you to educate
gosh.
the public, because before I began this company and was working with you, I had no clue what any of these things are.
Okay.
They're very medical. Let's first start with, and we talked about this in episode 1, but what is dysmenorrhea?
So dysmenorrhea is a Latin medical term for painful periods.
So basically all the time.
Yes, like periods hurt.
Yeah.
Bad periods.
So my question for you is, if you have painful periods, can a MediRoot suppository help you?
So I would say it's one of the ideal solutions for painful periods, especially because some people have pain with their periods and then all other times of the month they're doing all right. And I think people who don't have pain all month respond very quickly. And I find being proactive about menstrual pain is the most helpful, kind of like trying to treat the pain before it starts.
All right. So we talked about dysmenorrhea, but
Yeah.
what is dyspareunia?
So dyspareunia is pain with sex.
That's a fancy name.
It's a very fancy name for saying pain with sex.
It hurts.
Yeah. Ouch.
Yeah.
This can be for men or women.
Men too.
Yes. It's more commonly described, I would say, in women, but men can also have pain with sex, painful ejaculation, painful erections, or just sensitive skin that makes it hurt. And so, because dyspareunia just means pain, intercourse.
Yeah. So we've had a lot of people that will use this, and there can be different reasons for dyspareunia, right?
So many.
Like, give me your top 5 reasons somebody might be experiencing dyspareunia.
So in general, I would say it would be a broad dysfunction in the pelvic floor musculature and a hypersensitivity of the nerves in the pelvis. There could be other underlying causes between all that, but that's what it breaks down to, is the muscles are typically too tight and the nerves are hypersensitive.
So basically they're angry.
Yeah. Mad pelvis.
Mad pelvis. Yeah, and so a lot of people will use this, and again, this is not a medical recommendation, but when people have used this for painful sex, and again, I also highly recommend going to pelvic floor PT, right?
You gotta go.
Gotta go to your pelvic floor PT. If you don't have one, there's places you can go to get, find a pelvic floor PT in your area. Dr. Hill, Charity, do you remember that website?
Pelvicrehab.com.
Pelvicrehab.com. And I think they're also, does Herman and Wallace also have?
I think that is Herman and Wallace's, but
Either or.
I think there are other
I think
training
it is.
websites. That's just the one I know off my head because it's such a convenient one, and they will list all the providers who've gone through their training for manual work for pelvic floor physical therapy.
Yeah, and Herman and Wallace is one. There's many, just because I threw it out there, they train pelvic floor PTs in techniques to help with a variety of conditions. So definitely go to your pelvic floor PT, but when you use the suppositories, like 15 to 30 minutes before intercourse or penetrative sex, depending on the partners involved, that could potentially help relieve the discomfort.
It's definitely worth a try.
How about just a pelvic floor pain? Often there's a lot of different variations of this. So hypertonic pelvic floor, tension, dysfunction. Tell me and where is the pelvic floor? And can you stretch it out by yourself?
The pelvic floor is like a hammock of muscles at the bottom of your pelvis. Think about it like kind of holding in your bladder, holding in your bowels, holding in all your internal organs at the bottom there. It's not a muscle that's easy to stretch like it is.
Men and women
like
have it.
Your hamstring.
Men and women both have a pelvic floor.
Both have the pelvic floor.
Everybody's got a pelvic floor. All right.
Difficult, like
I can't put my leg over my head and stretch it.
You don't think about it, right? It's kind of subconscious, and it's there, so it is very difficult to stretch. It's not something.
So Kegels
can make it worse if it's already tight. So a lot of people are just like told do Kegels, but if you're in pain and have a hypertonic pelvic floor, that actually make you worse. And not stronger.
Pelvic floor.
Unless you're under the careful guidance of a pelvic floor physical therapist. And I wouldn't trust a pelvic floor therapist that hasn't physically examined the pelvic floor, meaning using their gloved hand to examine the pelvic floor via either the vagina or the rectum, because that's the only way to get a really accurate assessment of what's happening internally with that pelvic floor.
Absolutely. And then how do you even know if you're pelvic floor? I mean, what are typically the symptoms, or what somebody with pelvic floor pain and tension, what is that? How does that manifest?
In men, it can manifest as rectal pain.
Is this rectal pain all of the time, or just when trying to
Either. It could
defecate?
be either. It
Sitting,
could be
standing, sleeping.
It could be penis pain, could be testicular pain, could be pain just with erection or ejaculation, or it could be pain all the time that's quite crippling. And it can kind of manifest in any of these areas, depending on what nerves are irritated and how things are radiating. But those are all, sometimes you feel it more in the tailbone.
This is for men still?
For men, it can kind of happen anywhere in that hammock area at the bottom of the pelvis. Sometimes it can radiate into the hip or the groin. So you can have silent endometriosis. We don't understand why. Some people never know they have it.
Interesting.
Some people find out they have it because of infertility or other causes. And I think many people never get diagnosed, either because they're just diagnosed as undiagnosed infertility, because the only way to diagnose it is surgery. So unless you happen to have abdominal surgery and someone's particularly looking for it, you could just remain undiagnosed.
Interesting.
Many people, even with a lot of symptoms, aren't diagnosed, again, because people don't want to do an exploratory surgery just in case. But it's estimated 1 in 10 women, maybe even a little higher. I think there may be links to forever chemicals and hormone disrupting chemicals in our environment, increasing that rate. So yeah, it can involve invasion into the bowels, into the bladder, into the kidneys or ureters, and it can definitely contribute to ovarian issues, cycle issues, because of these chocolate cysts that forms, which are these endometriomas, these big balls of endometriosis that can form on the ovaries. It can cause lung collapse by coming on the diaphragm, growing on its diaphragmatic endometriosis, and so that can be a life-threatening condition.